Not so long ago, we had Thomas Watson from Heart Safe Dolphin Coast. And we were speaking about, he's got executive medical services, and we were speaking about the AED. And we were just chatting now, before we even get now onto today's topic, which is how to stop bleeding. And I was just, welcome back, Tom, first of all.
Oh, it's great to be here. Thanks, welcome, thank you.
Hopefully this is going to be something that we can do more and more, because we've got so many things that we can talk about. Yeah. But since we had you last time and we spoke about the pocket AED,
yes,
which someone can still find out from you how to get it, just look for Heart Safe Dolphin Coast or look for executive medical services. But the amount of places I've been and I've looked and I've seen a fire extinguisher and not obviously seen an AED doesn't mean it doesn't exist. But for those of you who aren't sure, that's the artificial external defibrillator. Automatic. And we were just saying now, you definitely hear more of heart attacks than you do of house fires.
Absolutely. You've got 100 times more chance of using an automatic defibrillator than you have a fire extinguisher. But there's fire extinguishers everywhere. So we've got to get the automatic defibs out there. And if you look at the logo I gave you now this morning, you'll see that I've called it a heart restarter, because people understand heart restarter more so than defibrillator. So it restarts your heart. The machine restarts your heart. That's the whole thing behind it.
If you missed that conversation, the full conversation is up on our Spotify. Just look for Plays It In. It's also up on our YouTube. Just look for Radio Plays It In. Plus, on our page, we've got some of the shorts, more of those still coming up. Today, though, we're going to cover another very important topic, and that is how to stop bleeding.
Yeah.
So let's get straight into it.
Okay, so as a cardiac arrest or sudden stoppage of the heart is critical, like we discussed, massive bleeding is just as critical. And massive bleeding is actually one of the main causes of death when it comes to trauma. And unfortunately, in South Africa, we have a high crime rate. As you know, we've got lots of shootings, lots of stabbings. And we have lots of car accidents. So bleeding can happen to anybody at any time. And basically, once we see the bleeding, we've got to stop the bleeding. Remember, I shared with you when I was shot, everybody just watched me bleeding and didn't do anything.
No one knew what to do.
And there, by the grace of God, I survived. But if you know what to do before the emergency service gets there or before you get them to an emergency department, that makes the world a difference.
I just want to say, I hope you're enjoying that we've given you the sound effects in the background.
On cue, that was spot on.
On cue, the sound effects of our blue light brigade just going through every red robot on Stop Street. Yay, government, yay. So first things first, when it comes to bleeding, if you don't have gloves, do you still help?
So that's an interesting one. From a personal point of view, that's a personal thing, number one. Number two, there is a risk involved. As you know, bodily fluids carry different diseases. Blood carries different diseases, HIV being top of the list, hepatitis being another one. So obviously having body isolation from that is the best thing, gloves, masks, etc. And you'll see when I go through this little pack that I brought with this morning, there's gloves in here.
Okay.
So we speak to that, the isolation. But if you don't have, that's a decision you're going to have to make. I can't tell you, yes, you must definitely do it, or no, you mustn't. And some people just can't do it because of the sight as well. It just freaks them out. So there's so many variables, you know.
Of course, some people really get freaked out. Are you not, so Devik, do you actually feel a bit weak or you want to pass out if you see blood? Yeah, a little bit.
More so if you see your own blood, right?
Yeah.
My brother's a big strapping Scotsman, and he's fantastic helping when someone else, but when it's his own, he freaks out.
I wonder what that is.
Yeah, it is what it is, right? I've had students with me, doctor students, nurses on the road, and they see the first incident and they can't handle it. So,
wow.
So coming back to your question, do you, don't you? That's a personal thing.
So personal.
Rather be prepared if possible and have those devices available.
With you right now, I see this little red bag. Is that the one? Yeah, this one. Is this a...
So this is a stop the bleed kit. Now we're talking about massive bleeding. I'm not talking about you've cut your finger, you need a plaster. That's a different type of bleeding, right?
Yeah.
That's easy peasy lemon squeezy. But the big bleeding, we're here on the coast. God forbid someone gets attacked by a shark. That's massive bleeding.
Yeah.
Someone gets hit by a prop of a boat. Massive bleeding.
Oh,
We've got to stop that stuff very quickly. We've only got so much blood in the body. How much do you think's in your body?
I have no idea.
So let me put it in perspective. A brand new baby that weighs about 3 kilograms has got the same amount of blood as a cup of coffee. 250 mils.
No.
Total blood volume. So for a baby or an infant to lose blood is critical because we think, there's lots of blood in the body, not the small guys. So you've got 70 mils of blood per kilogram body weight, roughly.
70 mils of blood.
So if you're
kilogram.
100 kilos, it's about 7 liters. If you're 50 kilos, about 4 or 5 liters. That's not a massive amount of fluid, okay? And when something happens, you get stabbed, you get shot, or whatever, we either have external bleeding or internal bleeding. External is easier to fix. We can see it, we stop it. But internal, that's critical to get them to the hospital, to the surgeon, that they can fix the inside stuff.
Okay, so let's start with external bleeding.
Yeah.
Someone has, let's just use been cut. It's on an extremity, leg or arm,
Yeah.
but it is bleeding quite profusely. Not bleeding like a heartbeat, not a
So I'm glad you said that because I was just going to bring it up. There's 2 types of bleeding. There's venous and arterial. Venous is more a oozing, flowing. Arterial is with every heartbeat, it pumps out, it's under high pressure.
Is one worse than the others?
On. Hectic, yeah. So arterial is worse. You're going to bleed quicker.
So the arterial is the one that the heart beats and you see the squirt?
That's the high pressure system, the artery. That's the big vessel.
So that's the one that's coming back from the heart or it's going to the heart?
Going to the body from the heart.
Okay, so it's coming from the heart, hence why every time the heart beats, and that's the even worse than the other one.
Yeah.
So what do we do for those two? So we're talking about extremities at the moment.
So, like we said with cardiac arrest, we're going to recognize, call, and act with bleeding, okay? We're going to pack it, wrap it, and tourniquet.
Pack it, meaning?
Pack the wound. So if there's a hole here, I'm going to pack it with
what?
With gauze, bandage, whatever you've got with you at the time. If you don't
Do
have
you
anything,
mean that? So if I'm wearing a T-shirt,
I mean it.
Even if it's
pack it. If you just put a dressing on top,
it's not going to do
It's just
anything.
going to take in the blood. It's not going to stop the bleeding. So we have to pack the hole, pack it, the gunshot, the stab wound, pack it with whatever you've got.
So that's if there's a hole, not like if it's a cut.
Yeah. If it's a cut, we'll wrap it.
Okay, pack it, wrap it, and tourniquet.
Tourniquet. So in that order, we're going to pack it, we're going to wrap it, and then we're going to put on a tourniquet. So if I can, I'll just show you.
Yeah, please. So as you're looking, for those of you who've never heard this word tourniquet, it's the word that's spelt with the ET at the end.
Yeah.
Okay, so
Exactly.
it said tourniquet. It's the thing that you wrap. What is a thing that you would wrap? Would you use a piece of clothing? You know, in the movies that someone gets a belt, or they use
as an improvised
They
tourniquet.
like tear the
Exactly.
piece of shirt and they wrap that. Is that correct?
It's not correct, but it's better than nothing, okay, at the time. So if you've got the proper tourniquet, I'll show you the tourniquet.
Yeah.
It works better. But let's say,
We are live on TikTok. If you are listening right now and you would like to see what's going on, just look for PlayZN on TikTok. Okay, so that in your hand now, is that for the packet?
so this is the packing. This is what we call a hemostatic agent. This is a
Quick
product,
clot.
looks like a tea bag.
Whoa!
And inside here, this product, when it comes into contact with blood, it rapidly dehydrates the blood of water and promotes clotting. Boom. So we pack it. That's one of the techniques.
Wow.
Pack it in there. So we're causing like a packing.
Yes, I see
And
that.
I'm not being funny, but back in the day when I was in the military,
Yeah.
our medics were called Tampax Tiffies
Okay, well, makes sense.
because we used Tampax.
I was about to say,
tampons
could you use a tampon?
Absolutely.
Okay.
Think of it.
Yes.
Put it in the hole, it swells up, stops the bleeding.
Okay.
Same principle.
So a good one to add to your first aid kit, a few tampons.
Absolutely. Yeah.
Weird question. Would you get an array of sizes?
Not really. I mean, it's going to swell up irrespective.
Okay.
So, the tampon works nicely in the hole. The stab wound, the gunshot, boom, swells
God.
up, stops the bleeding. Okay?
Could
it's
you-
a very crude way of doing it, but that's what we've done all
Well,
the
I mean, it is what
I've
it
still
is.
got it in my jump bag.
With the packet, wrap it, and tourniquet, is it the same for kids?
Everybody.
Okay, so this is
Everybody.
anyone that's got some sort of a wound that is a hole.
Yeah.
And a dog bite?
Dog bite, yeah, we can do on dogs.
Okay, so
Bites
it's not,
like
because I just wonder about, because of how dirty the dog's mouth is, that you're going to now,
The only thing, remember, a head wound bleeds terribly, even if it's just a laceration. They bleed
just
terribly.
because of how much blood is there.
It's
or
just
what?
a head scalp wound bleeds terribly, right? So when we say packet, wrap it, tourniquet, don't put a tourniquet around someone's neck.
Oh, God, yeah. Oh, do you think
Unless
someone
it's your
would do
mother-in-law.
that?
No, I'm joking.
Unless
no,
it's-
don't. No tourniquet around the neck, okay, if it's bleeding above.
So there's no tourniquet for
so
the
it's
heads.
tourniquets on arms and legs.
Okay, not the...
If we've got an injury in the abdomen or the chest, it's packet rapid. We can't tourniquet
Of
a
course,
chest.
no.
And if it's in the groin,
Yeah.
you cannot tourniquet a groin. So you take your fist, put it in the groin, put an elbow in the groin.
Just to try and
hold
stop
pressure.
that.
Yeah, so you pack it and pressure.
My gosh.
Yeah.
Okay, so
pack it,
we've packed
wrap
it, and the wrap is literally just around whatever you can, as
So
tight
just
as you can.
As tight as you can around it, okay? And then, if it's still bleeding, then we're going to do the tourniquet.
Okay, and so with Tom right now, he's getting out. It looks almost like what you would use for like a heart rate monitor
Yeah.
if you were running. It's got.
But it's got a Velcro. It
Yeah,
pulls
Velcro.
back on itself.
Okay,
You
so-
put it on the arm, for example, above where the cut is, or the wound.
Yeah.
You're going to pull it in.
Just come a bit closer to your mic if you can. Thank
Okay,
you
you're
so
going to
much.
pull it in here. Okay,
Whoa.
as tight as you can.
So he's just
Pull
wrapping.
it back, and then this T-piece here.
Yes.
This is where we're going to do the tourniquet. This comes and you twist this.
Is that to tighten?
That's to tighten. And once it's really tight, and it's quite painful, okay?
Okay, so
you're gonna
I was
clip
about
it
to
in
ask how tight.
as tight as possible until the bleeding stops.
And you
Okay.
can't, honestly, it might sound like a silly question, but you can't cut the bloods off so much that someone might lose a hand or
No,
an
there's
arm.
plenty time. Don't worry about
Okay.
that. And once we put it on, don't release it. Don't take it off.
Talking about time, does that say time on there?
Yes.
So do you put the time that you put it on?
Correct.
And you leave it on, not like when we were doing the CPR
They
when
used
you
to
were.
say, take it off. Just leave it on.
Okay, and
So
no matter arms or legs.
arms or legs. So pack it, wrap it, tourniquet. And if it's still bleeding, put another tourniquet above the first tourniquet.
So above meaning closer to the heart,
Closer, further away from the wound, yeah.
further away from the wound.
Yeah. Pack it, wrap it, tourniquet.
And
That's-
the
that's
tourniquet
how simple.
always goes above the wound.
Always above, about 2 inches above the wound. And never put it on a joint.
Never put it on a joint. Okay. Question
A
coming.
joint being your elbow joint, not a joint.
Oh, yeah. Don't worry, we know that. Question coming in from TikTok. Do you elevate the limbs if they're bleeding?
You can certainly elevate higher than the level of the heart, because now the heart has to pump harder to get the blood up there. So that helps if you direct pressure, pack it, wrap it, direct pressure, elevate the limb.
Okay.
Yeah.
So this is for a wound that has the hole in it. So let's say now it's a slice.
Yes.
So it's not a hole, but it's a slice.
Yeah.
So now is it the wrap it and
Pack it, wrap it.
still pack it, even if there's
So
not.
even if it's a slice, we can put that
On top of it.
On top of it. And then we can wrap it tightly.
Yeah.
And that's it.
Now, what if it is a bleed because someone has cut off something? A finger, a toe, a hand, a
An
foot,
arm.
a leg, an arm.
Yeah.
What then?
So, same principles. We're going to pack it, we're going to wrap it to staunch the bleeding, okay? And if possible, take the amputated part with.
Must
if
you put it on
possible.
ice? Is this a
Not
movie?
put it direct on ice. So if you've got a bag and you put the piece inside the bag, put that bag inside another bag with ice. Don't put the piece direct contact with the ice, because
Okay.
it can burn the skin.
Oh, of course.
Yeah, yeah.
Of course.
Yeah.
So into a bag.
Yeah. And if
Into-
you don't have ice, just put it in a bag and take it with.
Okay.
Let the hospital decide whether they can reattach it, do whatever. Don't make that decision yourself.
Quick question. Are you supposed to, when you go to the hospital, are you supposed to take with the thing if it was cut by a knife or an animal or whatever? Are you supposed to?
No, not necessarily. Look, if someone's been stabbed and the knife is still in the chest or in the eye or wherever it is, don't pull it out.
Don't pull.
Please don't pull it out. Leave it in situ, because think of it logically. If that knife is against an artery or a vein inside,
Possibly keeping it-
it's stenching the blood flow. If you pull it out, now there's massive internal bleeding, and we can't get to that. Even as paramedics, we cannot get to internal bleeding. We can put up drips, we can give certain drugs to staunch that bleeding, slow it down, but we can't get the surgeon's the only person that can open you up and stop the bleeding internally.
Whoa. Would you create one of those like donuts out of a towel or something if there is something in the eye or protruding anywhere?
Yes.
I've heard of people, I don't know, like rolling at something and creating
Yeah,
a
it's like
donut.
a donut, you're quite right. But what we would do with the eye is you would close the good eye as well. Because think of it, when you move the one eye, the other eye moves the same thing.
Oh, of course.
Yeah, so you want to close both eyes, right?
Oh, God, imagine having something stuck in your eye. Have
And
you had
then
to
you-
deal with that a lot?
Yeah, I've dealt with many. stabbing, gunshot, all sorts of stuff.
God, that's so rough.
So you got to just see. We teach airway, breathing, circulation, but with bleeding we actually throw it on its head. CAB, circulation. Stop the bleeding first if there's massive bleeding. Then go to ABC,
which is airway and breathing.
Yeah. So we do C first. Bleeding, massive bleeding. Stop it, because if you don't stop it, you've only got so much blood in your body. Once so much goes out, that's it.
Is there something you can do for someone who's got massive bleeding? As in, do you offer them a tea, a coffee, something sugary, water? Nothing. Leave them.
Nothing.
Leave them.
No to drink, no to eat, nothing. Because remember, once we get them to the hospital,
they might have to have a surgery.
Theatre.
Okay.
So they don't want anything. And generally, if it's outside in the street, someone's had breakfast or lunch. We know that. So we know there's going to be potential airway problems. But we're not going to give them anything to eat or drink or anything whatsoever.
Your TikTok, and if you are listening right now, if you have any questions at all about bleeding and how to stop the bleeding, you can ask us online. Otherwise, 072 330 3337. Once you've tourniqueted someone's extremity, do you just transport them or call the ambulance and leave them as is?
Yeah, so depending where you are, depending on the time of the day, it might be quicker for you just to put them in your car and drive to the nearest medical facility. Okay.
And if they're unconscious, same.
If they're unconscious, if you know what you're doing, have them on their side. Don't leave them on their back. Never.
Left or right side? Doesn't matter.
Doesn't matter. Unless they're pregnant. Put them on the left side if they're pregnant.
Why?
Because if a lady's lying on her back and the fetus is on her inferior vena cava, the main blood vessel that brings blood back to the heart, it compresses that and it drops her blood pressure. So we want them on the left side.
Wow.
But generally, it doesn't matter. Either side, because if you leave someone unconscious on their back, the tongue doesn't dive backwards down their throat. It just slides down and closes the airway.
Oh.
Or if they vomit, that vomit can go in their lungs. So it's not a good situation. So we have them on the side. So if you're close enough and you know where the nearest hospital is, okay, you can go there. Because sometimes the emergency service is so busy. I don't know if you saw those statistics I sent through in terms of the KwaZulu-Natal's EMS service at the moment. And that was the stats that they put out, not something I'm dreaming of. 28% they're getting to the calls within the time frame is crazy. There's not enough.
It's not even close.
So as communities, as people out there, when you see something happening, you've got to act. You've got to act quickly for bleeding and stop the bleeding as soon as possible.
Let's just remind everyone as well that number from any phone, I believe, is 112. Correct.
I'm impressed, Keri. I told you that like 3 weeks ago. Absolutely.
Oh, of course. I've remembered. And then I think it was one of our phones that you double pressed the side button.
Yeah.
5 times.
5 times on the iPhone.
So on the iPhone, and then I think something on our Samsungs does similar. If you press the side button 5 times, it will automatically emergency call. And that 112, that is from any phone. I believe even if you don't have data, it'll still make the call.
Correct.
A really easy number as well to tell your kids. And even like, if you've got a granny or grandpa around, a little bit elderly, it's a harder number to remember the longer numbers or to remember their own daughter's number. But a 112, and that is a number you can call for emergency from any phone, any phone at all. Would you call for your emergency before you even put on your gloves and start helping?
Yeah, that's always, if it's massive bleeding as well, you want to get back up there as quick as possible. So if you can get someone else to call while you're doing, absolutely. But you stop the bleeding as best possible until they get there. They'll carry on with other stuff and treat on the way to the hospital. And then if it's really bad, they'll already have the hospital on standby and say, guys, we need blood. We need to get into theatre straight away. We suspect X, Y, and Z. And sometimes we bypass the emergency department and go straight to theatre.
Oh, yeah.
Yeah. So it's a whole chain of survival concept.
A few things coming here on TikTok. The one asking about ice on your phone. So I don't know if you know about that.
In case of emergency.
Yeah, so is that a real thing? Do you guys, when you go to a scene, do you look at our phones and look at our ice contacts? Or
sometimes we will. It depends on the situation.
Okay.
Not everybody uses ice, but if there's an ice and we can access it, certainly we'll. Maybe not initially, but during the whole process, we'll look and see who to get hold of if you're unconscious, for example.
For those of you who aren't sure what we're speaking about, a lot of us were told a little while ago that if you put ICE, so the letters ICE, before someone's name. So if I have Tom on my phone, I have him under Ice Tom, Ice Baby, because it's in case of emergency. So that would be the person that perhaps if someone was able to access your phone, they would go there to find out the number of the person that would be called in case of an emergency.
Yeah.
There was something else that came through. when you make the call to 112 and there is bleeding, how do you tell the person on the other side the severity of the bleeding? What are the words that we use?
So massive bleeding, okay?
And massive bleeding would be just like you.
Just any amount of bleeding is massive, is lots. And remember, the guys and girls in these call centers have been trained in emergency care. So they'll prompt you on certain things as well. Where's the bleeding coming from? Is it spurting? Is it oozing? That type of thing. If it's spurting, we know it's high pressure, it's artery, massive bleeding, okay? So they'll speak you through it as well.
And then when it comes to the blood difference in color, can you tell a light blood versus a darker blood? Does that mean anything different?
You can, but it doesn't really make much difference for you in terms of bleeding. All it tells you is that the lighter color is the arterial blood with oxygen, high concentration of oxygen. The venous blood is darker because you've used that oxygen and it's come back to the heart to go to the lungs. So that's the only differentiator.
Okay.
Because remember, blood is not just blood. Blood is the carrying capacity for oxygen with a product called hemoglobin.
Yeah.
So when you're bleeding so much and we put up drips and we're just giving you clear fluid, your hemoglobin's gone. You cannot carry oxygen. It's critical.
Sure.
So,
someone coming through here. People just saying, thank you so much. Such a good discussion. Yes. If someone needs CPR and blood to be stopped, what is the most important thing to do first? Let's say I've got someone massive bleeding and I don't think they're breathing.
Yeah.
Which is the first?
Stop the bleeding.
Bleeding
if you don't
first.
plug it and you're pumping the chest, you're going to pump it out.
Oh, sherbets.
Yeah, so every time you pump that chest, you're pumping blood out if you haven't stopped the bleeding. So if you're on your own, it's a bit of a tricky one. Stop the bleeding first and get on the chest. But if there's someone else, then make sure someone's pushing on that area
Holding
to
it.
Stop the bleed as best possible. Because otherwise you're just losing the fluid out the system. Remember, the three things when it comes to blood: a pump, fluid, and pipes. Okay? And it's a closed system generally. It doesn't go anywhere else except in the pipes.
Yeah.
Okay? And it gets to the cells and it comes back. But now there's a break in the pipe internally or externally. Now it's bleeding out. Okay? So the pump and the pipes and the heart rate goes up and everything's going crazy to try and prevent you dying. But it can only do it for so long.
Oh
but if we can stop the bleed, we can help.
And with internal bleeding,
Yeah.
are there signs to look for? Because as we've said, now we know external bleeding, we can see it's obvious someone is bleeding out.
Yes.
What are the things to look for? I mean, some of me thinks that an obvious bruise, an immediate bruise would show internal bleeding.
Correct.
But what else can we look for to see if there is internal bleeding?
So,
eyes or?
Yeah, you'll see with eye injuries, you'll see, but with lots of bleeding, depending on the patient's skin color, okay, especially with patients with lighter skin color, you'll see them become very white when they bled lots. With patients with darker skin, we check the inside the mucosa, which is pink for everybody.
The mucosa is where?
Inside your lips, your tongue.
So you
Stick
look.
out your tongue. Oh, it's nice and pink. Stick your tongue out. But if you stick your tongue out and you're semi-conscious and you're bleeding and it's whitish, I'm starting to get very panicky because you're bleeding lots. Remember, you lose 500 mils of blood, a pint. That's all you can donate when you go to the blood transfusion. That's the sign, the first sign of shock when you donate that 1 pint. That's why they only take one, because you're going into shock already. That's why you feel giddy and all funky afterwards, and they keep you lying down and give you some juice and a cookie. Because if you stand up quickly, you're going to pass on.
No ways.
Yep.
Let's quickly, can we jump to giving blood? Do you know about blood and giving
Yeah, I
blood
know
and
a bit
everything,
about
right?
it.
So I remember at school we were told, like, and I'd go because you'd get out of maths and someone would give you, get a juice and a
You
cookie.
get a juice and a cookie, yeah.
So that's why I started giving blood, and now it's just something that I do whenever I can.
Yeah.
In the idea, two things. The one, it kind of makes you feel, I like the feeling. I feel like you're making new blood, but also because you're told you can save 3 lives. And
Correct.
From your side of working in the medical system, is the blood donation as important as we think it is? Is there another way to keep veins open without a blood transfusion?
Absolutely, blood donation is critical.
Really?
Not only for the pre-hospital side of it, but think of all the operations that are happening in the hospitals. People who are elderly going for hip replacements, heart attack victims, all sorts of stuff. Blood is critical. And it's a donation, so it's up to everybody to do it. It depends on your beliefs and religions, I get that. But for the best part, if you can donate blood, donate it. Absolutely. If it wasn't for blood donation, I wouldn't be here. When I was shot, I got 6 units of blood.
Oh my gosh.
Yeah, back in
So
the 80s.
6 units, is that 3
That's 3
liters?
liters. That's almost more than half of my blood volume. 3 liters of blood they gave me. So I was on the brink.
Wow.
So if it wasn't for the blood donation, I wouldn't be here.
And for those of you wondering, you can donate blood if you are 16 or older. I think it could be a minimum of 60 kilograms. And they'll check your iron.
They'll check your iron, that little blue container. They take a drop of blood and they watch it fall. And if it doesn't go in a certain time, they say, no, you're a bit anemic or your blood pressure's too low or whatever the case.
So they check your iron and they just have had some food that day before you go and give. But it's a very quick process. I think usually I bleed in like 8 minutes.
Yeah, it's quick.
It's like, it really is a quick thing. And I mean, someone told me once that if you give blood, that you kind of go to the top of the list if you need to receive blood. Is that rubbish?
Probably, because it's more about the criticality of your case at the time.
Okay.
So we do a thing called triage in medicine, which means we sort out the most critical patient at the time with the resource that we have, be it pre-hospital or in-hospital. So if they've got patients who are critical and you happen to have given 100 pints of blood in your lifetime, critical guy's going to get it before you do. Because you're not that critical, for example.
Yeah.
But, I mean, look, it's like a parachute. You don't need it until you need it.
Yeah.
So if you've donated blood, you never know. Your blood donation might save you one day.
Oh, wow. Oh, wow.
Yeah.
And if there is a situation where I'm bleeding out and I'm in hospital and I need those 6 pints of blood, can we phone my family? And can they come in and donate for me, or is that not how it works?
Not to that stage. No, they'll take universal donor blood, which is O, okay?
Yes.
They can donate. Then you've got AB and the rhesus factor and all that stuff, so it gets quite complicated. So they'll use universal donor blood for everybody in emergencies.
Is that O negative or O positive?
O negative.
O neg, okay.
In emergencies, okay? And you still get reactions to it, etc., from the antibodies, but it will save your life.
That's wild.
Yeah.
Is the blood that comes in at that point, the transfusion, is that literally to keep oxygen moving around and to keep the veins open?
It's to keep the pressure up, okay, because we need volume.
So we couldn't use like another solution?
No, we do. We use what we call Ringer's lactate or normal saline, which is a colloid, and it's just what we call a blood volume expander. That's all it's doing.
Okay.
It's keeping the volume and the pressure.
It's like when you put wheat into a sauce to
exactly, to beef it up a bit.
To beef it up, yeah.
But now the problem is if you get too much of that and not enough red blood cells, you don't have enough oxygen carrying capability. That's the problem.
Ah, that's intriguing.
It's a special fluid, this blood. It's not just red stuff.
I see now coming up, here's a few things. So someone asking, can you donate if you have tattoos? You can, but you have to wait the 2 or 3 months after your last tattoo. So if you are going to get a new tattoo, give blood first.
And it's more about HIV status.
Yes, well. Yes. Yeah. My hubby donates blood. Why does he bleed out profusely after the donation? That's not right.
Well, it depends. How old is he? Does he have pre-existing medical conditions? Is he on a blood thinner? Is he taking aspirin?
Gosh.
That makes you bleed.
Oh.
Yeah, so there's so many different variables.
Then another question coming in here. Everything that you're speaking about, does this also apply to animals?
Yes, absolutely.
Same.
Yeah, same. Animals are animals the same as us. They've got hearts, they've got pipes, they've got fluid. If they're bleeding, stop the bleeding.
So same, it's packet,
rapid,
tourniquet. And with an animal, same. Even though, I mean, it's hard to keep them still, but you do the same tourniquet on their little legs or arms.
Exactly.
Not neck, not chest, not abdomen.
Yeah.
And baby the same. You can even tight like that on them.
Yep. To stop the bleeding. As soon as the bleeding stops, that's tight enough. It's the same with when you're doing breathing for a patient. As soon as the chest rises, that's enough air.
Okay.
Yeah.
All right. Anyone else? Any more questions? Any questions? Are you good? Is there anything else you want to add about stopping the bleeding? If there's a specific blood pressure. Oh, hold on. Is there a specific blood pressure range? Oh, let me see what this question was. To deem healthy to donate. Oh, I'm not sure. Or is it irrelevant what your blood pressure is?
It's all about your age more so than anything. So they'll gauge it against your age. There's different parameters for females and males and all sorts of stuff. Yeah.
Well, look, those of you who are listening right now and you're wondering about giving blood, you can get hold of your closest SAMBUS, SAMBS, find out where they are when you go in there, and they really are so gentle, and you can choose the arm you want even to use, and just go give it. 1 pint can save 3 lives, I believe. They separate into the platelets and then the 1 and the 2. So just imagine, and you, like you were saying, you never know until you need it.
Correct, 100%. And please remember this. Do not be standing waiting for the ambulance. If someone's bleeding or if someone's in cardiac arrest, get on their chest, compress the chest if they need it, stop the bleeding until we get there. I cannot emphasize that enough.
If you want any more information, please go online, look for Heart Safe Dolphin Coast. If you don't have a heart restarter at your business or your hotel, your home, anywhere really, where there is a heartbeat, we need to have these AEDs, these heart restarters. You can get hold of Tom Watson and find out exactly how you can get one as well. Or just look up Executive Medical Services. These that you've got with you now, these blood...
Stop the bleed kits. Yeah.
Stop the bleed kits. Where does one get something like
this? Get them
this?
through me. I've got them. I can supply them.
Okay. And would a stop the bleed kit fit into your first aid kit, or are these two completely different?
So a first aid kit's more just bandages and plasters. This is specific for big bleeding. Stop the bleed. And if I can take you back, it became big in America after the Boston bombing. Remember the Boston Marathon?
Yes.
The bombing. A lot of the people coming in at the end of that race had limbs blown off and all sorts of stuff. And if it wasn't for the lay people there who knew what to do, a lot of those folks would have died.
Oh,
and that's when it got massive. And all with the Americans, with all these school shootings, which is crazy.
Yeah.
Stop the bleed kits are actually next to the AEDs.
Stop the bleed kits are next to the AEDs. A quick last question with a gunshot.
Yes.
If there's an entry and an exit wound, just pack up both sides.
Pack up both sides. You'll find the exit wound is usually bigger than the entry wound.
Yes.
But it doesn't matter if it's bleeding, pack it, wrap it. And if it's on a limb, tourniquet if it's still bleeding.
Good God. Oh, there's a lot. Devek, how are you?
I'm okay.
Okay, he's okay. He's okay.
Not a lot.
Let me just check here. Do you have to abstain from anything to prepare for donation? I think like just dwellums, like anything.
Yeah, just stay off the drugs and the alcohol.
Yeah. I mean, obviously, You want this is blood that's going to be in someone else. You want it to be as clean as possible,
and they'll have a process that they check
and be honest in your questionnaire.
Be honest,
And if you've been having a little gander with other people and their bodily fluids, just give it a little while before you donate. Let me see what else is here before we go. Oh, how much is that kit that you've got there?
So this specific kit that I've got at the moment is 650 Rand.
Oh, brilliant.
Yeah.
And everything in there's a use once, one use.
Except the Koki. You can keep the Koki and use it again for the time that you drink.
And then someone also asking if you want to buy gloves to use in a situation like this.
Get them out of the pharmacy.
Like, it doesn't matter. Any gloves.
Any gloves.
Any gloves.
Even garden gloves, if that's all you got at the time, you got garden gloves.
Anything that'll separate your hand from
Correct.
someone else.
100%.
You are amazing, and thank you so much for all of this information. And again, we hope we never have to use this, but in case of a situation, like I was with those dogs last weekend, no idea.
Rather have it and don't need it than need it and not have it.
Yeah, exactly.
Yeah.
This is Plays It In. I know we are very late for news. Do you want to leave news or? Play it. Okay, it's Plays It In. Thank you so much, Tom. This will be up on our Instagram as well as our YouTube as well as our Spotify. And please go and look up Heart Safe Dolphin Coast for any more information.